All right, I think we'll get started now. Good morning, good afternoon, good evening to everyone, and welcome to our webinar on maintaining joint health for people with bleeding disorders during COVID-19. We have a distinguished faculty from our musculoskeletal committee on board to give us a number of insights and expert opinion on what one might be able to do during this unprecedented period of time. It's worth pointing out that we're visiting with people from all over the world. You're going to have your own individual healthcare systems. And so everything we say may or may not apply completely to the situation that you're in. And it's good to just remember that decisions need to be made on a case-by-case basis. If I could have the next slide, please. Here's our faculty. So my name is Glenn Pierce, and I am the Vice President of Medical with the World Federation of Hemophilia. We've done a few of these COVID seminars in the past, and this time we're fortunate to have members from our musculoskeletal committee. I'm going to ask them to each introduce themselves, and then we'll go through our agenda. Greg?
Thanks, Glenn. My name is Greig Blamey. I am a physiotherapist from Canada, and I am currently the chair of the World Federation of Hemophilia's Musculoskeletal Committee. Pamela, over to you.
Pamela, you're on mute.
Thank you. Hello, everyone. I'm Pamela. I'm a physiotherapist. I have been on the MSK board before, and I'm right now a national resource person for musculoskeletal problems in the bleeding community. Thank you. Over to Cesar.
Everyone, I am Cesar Haddad. I am from Lebanon, a therapist working in hemophilia care with the Lebanese Association for Hemophilia. And also I am the junior vice president of the musculoskeletal committee. And now to Andrew.
Hi everyone, I'm Andrew Selvaggi. I'm a personal trainer from Melbourne, Australia, and I'm a person with a bleeding disorder, active member of the MSK community.
All right, thank you all for your introductions. Let's move to the agenda, please. And so we'll start off with Greg discussing the impact of the pandemic on joint and muscle health. We'll move on to Pamela to talk about home-based exercises, tips from the field. Then we'll move on to telemedicine with Cesar, best practice and practical tips to be most effective. And then finally, we're back to Andrew, stuck at home challenges for patients. I'm particularly looking forward to hearing about that one, since I'm also stuck at home. Moving to the agenda, past the agenda. I want to point out that we have made a number of webinars in the past on COVID-19, and so we do offer practical recommendations. Although they were made about 2 months ago, they remain completely current today. Nothing has changed that would change any of those recommendations. And they do discuss the specific risks as well as some of the issues in delivering humanitarian aid. And then I'd also point out on the website, we have updated news there from the companies as well regarding product supply. Next slide. If you want to ask a question, we have a Q&A box at the bottom. And so please use that. And we will collate the questions and then answer them at the end of the session. And we'll run the session for as long as we can after the hour, 15 minutes, probably another 15 minutes or so to make sure we've covered as many questions as possible. Next slide. The recording for this webinar, like our earlier webinars, will be on the e-learning platform. So I would encourage you to look at that if you are missing any of this, or if you want to refer this to your friends or colleagues. and then it also will be translated. Next slide. So we have a few questions that have come up repeatedly. Are people with hemophilia at increased risk of having COVID-19? The answer is no. Individuals with hemophilia are not at increased risk. There are a number of well-defined risk categories that do increase the risk of severe disease for individuals, but there's nothing specific to hemophilia. Can COVID-19 be transmitted through plasma products? No, it cannot. We think that that is very unlikely, but our blood safety, product safety committee is looking at that and monitoring that very carefully. But to date, despite intensive surveillance, there's no evidence that that is occurring. And the last question, does COVID-19 treatment protocol require special care for people with bleeding disorders? The answer there is yes, it does. COVID-19 is inducing a complicated kind of coagulation, coagulopathy, where there is increased risk of thrombosis in individuals who do get COVID-19. And so mix that with a coagulation deficiency, and one has a complex situation to manage an individual with hemophilia if they have severe COVID-19 and are hospitalized. And one of our webinars did cover that. There are additional webinars from the ISTH that also cover that. So the key thing there is to make sure that the Hemophilia Treatment Center healthcare providers are involved if an individual does get COVID-19 and requires hospitalization. Next slide, please. So I will turn it over now to Greig, who will start the session off. And before I do that, I'd like to make some acknowledgement to the Hemophilia Alliance. The Hemophilia Alliance is an organization in the United States that is involved in factor distribution to hemophilia treatment centers throughout the country, and has been able to take some of the funds that they provided to bring people to our meetings and channel them to these webinars, for which we're very appreciative. Okay, Greig?
Thanks, Glenn. I think the topic that I am speaking to, the effect of the pandemic on muscles and joints and the health of the musculoskeletal system, it would be, I think, easy to assume that what I'm going to do is kind of go through a litany of the negative impacts that the pandemic's having on all of our musculoskeletal tissues. And while that's partially true, I think it's important to see some silver linings too. And for some of the losses that we suffered, there I think are some wins as well for some of the tissues, not all. And what I want to do is split this into a discussion of joints first and then muscles second. And within joints, we'll split it further into discussing a little bit about bone health and then the soft tissue components of the joints as well. Bone health really, if we use one of the indicators of bone health being bone density, and we know that part of that, a big part of it, is maintaining a weight-bearing regimen that helps to build and then maintain our bone density. For a period of a few weeks, if you are at a decreased level of activity, a decreased level of weight bearing, the results would be negligible and really not worth discussing. But we are now several months into the pandemic. We very likely have many more months to come. It's different in different parts of the world. And over a period of many months, there may be measurable changes to people's bone density if they have not been maintaining weight-bearing exercise. And I'm not going to discuss methods of maintaining health in this topic because my esteemed colleagues are going to be doing that in the upcoming presentations. However, if you happen to have a lot of arthritis and damage to your bones in the weight-bearing bones, so we're talking really the bones around the joints of the ankle, the knees, the hips, it's very possible you may be feeling better right now. If you have been at a decreased level of activity and not on your feet as much, certainly there's a possibility that symptomatic arthritis may actually be feeling better than it has in a long time for you. So really, you could look at this in both ways. And for some people, there may be some benefits that they have found from the enforced rest, such as it may be, that's been imposed upon them. For soft tissues in the joints, and we're talking about things like the joint capsule, the synovial lining of the joint, ligaments that form stabilizing structures within the joint capsule. Again, I think there's some positives and some negatives that we may draw. A lot of people with hemophilia, you have chronic synovitis, thickened changes to the synovial lining that have come from multiple bleeds and injuries. And any physiotherapist on the call will tell you that the hardest thing to get patients to implement is an adequate amount of rest when trying to recover from an insult to the joint. And patients will tell us that the hardest thing for them to implement is an adequate amount of rest, because people lead busy lives and it's not always possible to stay off of a joint as long as we would like you to. So again, if lockdown, such as it is in your country, has imposed upon you more time at home, less time out and about and at your job or workplace, you may be finding that the treatment regimen for your synovitis has proved to be more effective. So more rest, less impact to the joints, the other aspects of your treatment regimen, if it's factor availability that you have, if it's a physiotherapy program, if it's anti-inflammatories, you may be finding that your chronic synovitis is doing better than it has done in the past. However, one of the aspects of soft tissue joint health that I speak about a lot, and it's very near and dear to my heart as a physiotherapist, is proprioception, which goes by lots of different names. You may know it as kinesthetic sense or joint position sense. The ability to control our bodies dynamically as we move without looking at where our joints are, being able to feel the positioning of our joints. And a lot of that skill comes from nerve receptors that are located in the joint capsule. And like any skill, it is only honed and well practiced and effective if it is used regularly. And balance challenges when we are out and about, walking on uneven surfaces, being in crowded places where we have to change directions to avoid collisions with other people. These are the kinds of things that challenge our balance and keep it healthy. And if you have been at home for most of the pandemic, then you may be finding that your balance control, because you're walking on smooth surfaces in your house, you are not out and about in crowded spaces, and so the balance skills that you have may be, over the course of many months, placed somewhat at risk. If I move over to muscles, and I think that the news is not as binary for muscles. I really don't see a lot of benefits to what has been imposed on most people in the lockdown for the muscular tissues. But I want to highlight three main elements. I want to talk about strength, I want to talk about flexibility, and I want to talk about endurance. Strength is sort of an easy one. It's a pretty simple relationship. If you don't use it, you tend to lose it. And if you have been more sedentary, not using muscles and being more active, or not engaging in a home exercise program over the course of a few weeks, probably not a problem. Over the course of several months, you are going to see a downshift in your level of strength. Flexibility. The joints that I want to highlight mostly here and the muscles that surround them are the knees and the elbows. Hinge joints that for anybody with hemophilia already tend to be at risk of losing the end range extension or straightening of the joints. And more time spent sitting, more sedentary lifestyles will keep your knees usually from getting into fully extended positions. If you are at home, most of the time, we tend to set up our homes to be a convenient space for us. Things are within easy reach, and so your elbows may also not be getting as regular exercise into fully extended positions. And so the insidious loss that we need to be on the lookout for is that slow, over a long period of time, loss of the ability for our muscles to allow our joints to reach full extension. And so the knees and the hips, I think, would be most at risk in that regard. And then muscular endurance, of course, I'm talking about the ability to perform tasks over and over again. And if you are not active, if you are not having to get out of your house, go to your job, do your usual activities, the likelihood is that you're not being as active in a general way. And so again, the longer that the pandemic plays out for, the higher the level of risk that your muscular endurance is going to start to degrade. I wanted to finish by saying two things. Lockdown has not been the same for everybody, and the impact of the pandemic writ large is not the same in every part of the world. And in Canada, the phrase that gets used is essential workers. And I think that certain job categories, like physicians and nurses as an example, healthcare providers, physiotherapists, other people, you always know that those folks are going to be at the hospital or at the clinic there to look after you because they've been universally deemed essential workers. But one of the categories that we've learned is that if you happen to work in anything to do with the food supply chain, if you are a farmer, if you are involved in getting food from production to marketplace, if you work in a grocery store, you have been an essential worker during the pandemic. And there are definitely people out there who've been working harder during the pandemic than they normally would work, more time spent on their feet. A lot of workplaces have removed seating areas to try to control spread of the virus. And so there are less places to sit down and have a rest. So you may be finding, if you are in one of those job categories, that you have certainly been getting plenty of exercise, and you may have been having an exacerbation of some of your pre-existing symptoms like arthritis in your joints. And then the last thing to end really on a positive note is, I don't know any of my patients with hemophilia who don't have some kind of chronic nagging injury that is with them for months or years, and they function in spite of it. And it is possible that during this pandemic, if you have been at home much more than you might usually be and getting more rest, you might have had the opportunity to have some of those chronic injuries really resolve themselves to a much greater degree. And while that's a good thing, I think that the real key here is, as we come out of lockdown and your activity level starts to increase, how do you do that safely so that you don't re-provoke one of those old injuries or create a new one because you may be at a decreased level of fitness after many months of being more sedentary? And I think that's a good segue into the next few presentations about how you can do things at home to maintain and improve your joint and muscle health. So we're going to travel instantaneously now from the central part of Canada to India, and I'm going to pass the ball over to Pamela. Pamela?
Hello, everyone. Thank you, Greg. I hope you can hear me. Yes. Good afternoon to everyone, or good evening as it is here in India. I think Greg, even though Greg and I never actually spoke in detail about the webinar, I think his background has been so perfect for the little practical demonstration that I have arranged for this webinar. So without much ado, I'm going to go on to go through two quick practical demonstrations. One is a simple exercise workout, which will work a little bit on strength, on flexibility, and your core function. Then we thought, because as Greg quite rightly pointed out, the knee joint and the elbow joints, which are the hinge joints, are the most commonly affected among hemophiliacs. So I'm going to quickly show some simple static elbow exercises, which one can use while a bleed is resolving in your own home, or once the acute phase is subsided. And it would be probably an easy way for you to ease into exercising your elbow. Now, for the purpose of my demonstration, I'd like to introduce Abhishek. Say hello to everyone. Hello, good evening, everyone. So Abhishek is a 20-year-old college student from our local community. He has severe hemophilia B. I know Abhishek from when he was 10 years old. So we know each other for a long time. When I first met him, and he still remains clinically a severe bleeder. He has had the opportunity to go on to low dose prophylaxis whenever we've had some factor availability. But mostly his musculoskeletal problems have been entirely managed by physical therapy. He's a great role model, great inspiration for our local community. There has been a film even made about his little story about 2 years ago and televised nationally. So right now, Abhishek is in pretty good health. He should be able to do all the little exercise workout that I've arranged to show you. He did have bilateral elbow bleeds, one after the other, a couple of weeks ago. So his elbow joints bleeds are just resolving. So again, that is sort of in the right time to show you some static elbow exercises. So we'll start with the warm-up. So I need to, I'm just going to switch the video. Yes. You can all see him? Forward. Right. So if you start off with your head, take your head and neck forward. We'll repeat each movement twice for the purpose of this webinar, but it'll be good to do the movements gently and slowly, about 5 to 7 times per routine. So take it forward and back, forward and back. Good. Do it slowly and gently. Now side to side, rotation, yes. Ear to shoulder, ear to shoulder. Again, ear to shoulder, ear to shoulder. Now turn your head side to side. Great. You can put on some music when you're doing this, right? And now some neck rotations to kind of enjoy the routine. And please do these mindfully and not mechanically. You should relate and be able to connect with your body and your joints as you're moving. That makes exercises much more effective, right? Now do the rotation the opposite way. And within your abilities. Right. Next to shoulder straps. Shoulder to ear. Great. Right. Now square your shoulders. Yeah. 1, 2, 3. Great. Now can you rotate your arms? Yeah. On this side. Remove this. Yeah. Rotate. Yeah. As you can see, he has had several problems in the past. His shoulder range is a little limited, but he's able to move it and he's doing it within his ability. Backwards. Great. Now, if you can do the arm hugs. And your arm forward and back like this. Yeah. As high as you can within your comfort. So this is when he's in a quiet phase. He doesn't have any major acute joint bleeds now. Right. Next, if you can do your elbows. Great. Put your hands out forward, right? And turn your wrists nicely. Yeah, and the opposite way. Good. Open and close your fingers. Great. All these exercises require no equipment. You just need a space to be able to do this safely. Then bend forward. And up. Now again, bend forward. This again, it is an action of reaching your toes. You don't have to touch your toes when you're doing this. Again. And take your foot back. Great. Straighten up. And again. And engage your core and come up. Right. One more time. Great. Now sideways. Reaching down to your knees as far as you can. Again. Then one more. So in fact, there was to have been a disclaimer at the beginning of the webinar, but I'd like to say that this is purely generic. It is not prescriptive. It is meant to be inspiring and to give you some guidelines as to how you can exercise yourself at home. Right, then, patients. Yeah, good. Right, great. Now the pelvis. This movement nicely, yeah. And the opposite way. Okay. Rotate your knees. Yeah, unmove it. And the opposite way. Great. And you take the support of the plinth and move your to the hip swinging. Okay, right. And we will not demonstrate the other side. We need to turn. So I'm not going to make him do that. And then do the side. Right, great. And can you do the ankle movements? You can see it. And the other way. Right, great. So this is a safe mobility exercise or warm-up routine. It can be made into a strengthening exercise by using sandbags, right? This is a 1/4 kg sandbag, which I get made so particularly for hemophilia patients, so they can use it. It's only 250 grams. And this is, I'm sure everyone is familiar with resistance bands. These can also be used to make this particular routine a bit more challenging. But we can't go through the details because we don't have that much time. Now to end this routine, I'm going to ask him to do some sit to stands. So for those of you who are working from home, studying from home, this is a very easy exercise to engage your core. It's a very functional exercise. And by doing a few medium level squats, it will actually exercise and energize your whole body. So you just do it. So both feet are on the ground. Now stand up. So while he is doing this, I have told him to engage his core. So he's got to engage his abdominals, engage his low back. Continue. Do it. I suggest for those who are not familiar, just do it 2 or 3 more times. You do this about 3 to 5 times and then build it up. Be very gentle when you start and engage in an exercise program, particularly in situations where we do not have access to factor. In fact, Abhishek used to have a right knee flexion contracture. He was non-ambulant when I met him when he was 10. And he's come this far with a little bit of support from factor and largely by physical therapy. So right now he's not on prophylaxis. He doesn't use factor regularly. So that brings us to the end of this little workout routine, which can be used by patients with mild or moderate hemophilia with mild joint disease, can be used by severe hemophiliac who is in a quiet phase, his joints are not bleeding. It's excellent for that. Now, please lie down. Yeah. So I hope you can all see him here. So assuming someone has had an elbow bleed, once the right stage is crossed and we assume that bleeding has resolved and we are around, say, anytime between days 7 and 10. So apart from the days, one needs to make sure that the swelling has come down. There should be no warmth. I'm talking about situations where we don't have MRIs and scans always to access to make this decision. So I usually make a decision with just touch, and palpation and observation. So swelling should reduce significantly. There should be no warmth. The patient's pain score should be around 5 or less to be able to do static exercises. Okay? And the middle range of motion should begin to come. So, just a minute. Now, Abhishek is quite well. He had a bleed 2 weeks ago. He's been on a physical therapy program. He does have full range. But usually, as the bleed resolves, this will be the range that you will see, just the middle range. So, at this stage is a good time to start isometric static exercises. Isometric exercises are exercises which involve no movement of the joint. We're only going to be tightening as much as we can the muscles around the joint. So, if you put your hands like this, and now before we do elbow statics, we're going to do some static scapular exercises. So, can you just push your shoulders and your, yes, good. 1, 2, 3, 4, 5, relax. Do it again, push down. 1, 2, 3, 4, 5. So static scapular exercises are important because the proximal conditioning is very important to protect the elbows for reasons we can't go through in great detail in this session. So by doing it in line, the entire body gets support. There's a lot of protection, and it's a very safe way to engage in this particular activity after bleed. Can you sit up, please? Now Abhishek is going to show how to do static biceps and static triceps exercises. These are the main muscles around the elbow. So there's bulk in front and the bulk at the back. Okay. So what he will do is he bends his elbow at 90 degrees, palm facing upwards. He makes a fist so he can do a maximal voluntary contraction. And then below the biceps. So he puts his good arm on his forearm, lower third, and now tries to bend this right elbow. Bend your elbow. So you can see his biceps coming in there. Holds for 5 counts. You can hold for 1 count or 3 counts or not hold at all. Simply contract and relax. Okay? And relax. Repeat again. 1, 2, 3, 4, 5. Relax. Abhishek is quite fit, so he can do it up to 5 and even 10 counts. Right. Now demonstrate the triceps. Yes. So here he's pushing down with the right elbow, activating his triceps here. He's pushing onto his good arm, and his good arm is pushing him up. And that gets his triceps going. The wonderful thing about this exercise is usually patients never hurt themselves when they do this. So I much prefer, if I'm doing remote physiotherapy, which is a lot nowadays, I teach patients to self-help so that the risk of bleeding again, and particularly in our situations, is virtually not there when they do it for themselves. Okay? It is tricky when you have bilateral elbow bleeds at the same time, and that is a story for a different session. But usually when people have unilateral, they can help themselves with the other arm. Thank you, Abhishek. Thank you so much. So I come to the end of my session now, and I call upon Cesar to carry on with the webinar. Thank you so much for a patient listen. Thank you.
Hello, everyone. And I want to thank you all for joining us today in this very instructional session about joint health for people with bleeding disorder. What you have seen with Pamela explain very much what I'm going to say into more developed things. Pamela showed us now how telemedicine have changed our world. Now we can see through online consultation, online sessions to do at home. And as Dr. Glenn at first said, that he was at home and did nothing all day, any exercise or without any movement. So this kind of instruction or telemedicine, or we are going to discuss even more about consultation, are the aim of my talk. As you all know, during this lockdown period, we were all obliged to stay home unless it was for something very urgent it needed a lot of permission justification. This has made it very difficult to all of us to continue our daily routine and activities. A lot of people with bleeding disorder took benefits of this situation to just stay home and do nothing. And this created even more problems, weaker muscles, more pain, more stiffness, and even limited function. So the only exercise I will talk about myself that we did was to go to the fridge and to go find something to eat. So this is the only walk we were able to do every day, or look online for recipes to try. So healthcare professionals have to find a way to adapt to this new situation that we are going to pursue the mission of always being functional. While many governments have non-essential travels, have had the telecommunication consultation to suit this situation. So among these techniques, there is some called the telemedicine or on consultation and follow-up. A lot of healthcare professionals have had to adapt and introduce this kind of communication in their practice to motivate and to continue have access and continue stimulating the patient to adhere to a rehabilitation protocol. So if we want to define the term telemedicine itself, it means to healing at a distance. So criteria defines this telemedicine. The main purpose is to provide clinical support to improve overall health outcome. So the main aim is to overcome the geographical barrier, and it involves many various types of platforms that you can use to facilitate this aim. In telemedicine or online consultation, there is two possibilities. It is either passive, where you can see a video, an instruction video on YouTube, or like what I have done now, but it's very important to know what exactly is of the exercise, because if you don't know what you are doing, be maybe providing more detrimental problems to your joints and health. And there is the second possibility, the interaction between a healthcare professional and the patients themselves. And the patient can explain freely what are their concerns, what are their needs, what are the problems that they are facing. A rehabilitation program can be built accordingly. Nowadays, and as you are attending here on Zoom, you must have been, there is many platforms that can facilitate your contact with a healthcare professional. You can ask your treatment center at your country about the contact details of care professional to continue have your questions answered. It is, for example, if you want the video calling, Facebook Messenger, the Skype, for example, or for some countries, it is difficult, the problem of connection and internet and the electrical cut. So you may always use regular phone call, but of course, it will not be like a video calling where the therapist can see what you are doing. But of course, it's a possible way to overcome the problem of internet connection or electrical cut. If we want to ask ourselves, when is online consultation needed? So it's indicated for clinicians who are self-isolating, It's intended also for patients who have symptoms of COVID-19 and want to ask their healthcare professional what to do. It's important also for patients who are at high risk of getting this infection, who have a medical condition or health condition complexes. Also for patients who are anxious to wait in the waiting room for healthcare professional or visit. And this technique, it's highly very important for the patients who are physically able to move. So if you have any problem in the joint, difficulty to move around, you can contact your healthcare professional using online consultation, and it will be easier for you. Also for people who live far from the center or the hemophilia treatment center. I want to share with you what to expect, or what does the healthcare professional want from you during this kind of online consultation. So healthcare professional will be asking about medical history to know more about what you are feeling, the number of bleeds, for example, the location of the bleed, the clotting, if you are under prophylaxis or not, if you are taking your clotting factor or not, if you have any targeted joint, and you can discuss with the healthcare professional. It's very important to discuss the level of pain. Are you having a lot of pain? That's your pain. When is this pain happening? This will give the healthcare professional a broader idea on how to build your exercise program accordingly. And also, he might ask you to do some simple tests for demonstrating the range of motion, the strength that you have. So these are the kinds of things that you expect during an online consultation. If we want to highlight when our online consultation not recommended, if we want to highlight when is it not recommended, it's not recommended if you have a tendency, a high tendency, and you don't have clotting factor at home. It is better because a healthcare professional then must see the level of your inflammation or inflamed joints, so it should be taken into consideration. And also with high health condition, also preferably to do a face-to-face consultation instead of the online consultation. I will give some tips. I know a lot of also healthcare professionals will be joining us in this session. So for the healthcare profession, it's a new way of thinking, a new approach. We don't on our hands to feel the problem or to try to know what's happening. So a healthcare professional could be enjoying educating the patient or have good education with the patient, because you have to give clear instruction and understand to permit the patient to know what you want from him. Also, they should have, of course, evaluation skills to know from a far distance when the patient tells him, I am feeling this or I am feeling that, what to expect or what is the diagnosis for such condition. It's a patient care, so it's not just we do it by thing and that's it. It's after all an approach for the patient. We must be able to listen carefully what they want or what they, and adapt our program to the needs of the patient. So, and also for the therapy, we should be active, as you have seen with Pamela. She was not sitting and giving instruction patients with her. She was saying him, you should do like this, you should do like so. The session should be interactive and not just talking on the phone or on the approach applications that you are using, either Zoom or whatsoever. Of course, the healthcare professional should verify the identity to keep a privacy for such communicate, because it's one of the barriers and challenges of this kind of approaches. If I want to give practical tips for the people with bleeding disorder, what they must prepare before they start the online consultation or telemedicine. At first, you should make that you have the good technology in place. For example, you have phones that have video calling possibility, a laptop that have video calling possibility. So the software, make sure that it's good, and the hardware, make sure that it's good. Secondly, try to be placed in somewhere that you have good internet connection, because you need to hear properly the instruction, and the therapist needs to listen very carefully what you are doing to prevent any kind of damage or something. Always have your software up to date, because there is always some kind of egg or in the software that helps you facilitate your approach with the therapist. Make to have good space, because as we have seen in Pamela, I'm taking her always as a reference, but as you have seen with Pamela, she needed a place to show the exercise. So if I ask from somebody to show me the exercise, you need not only a chair or just sitting. I need, you will be needing at least to do some exercise. Very important notice, if you're doing exercises based on pre-recorded videos, or you should know very carefully that not the exercises are for you. So every is different. You should know, you should respect and know your limitation. And because sometimes whenever we don't do a lot of exercising, we just come immediately to doing too much, and we start fast doing this after doing little for too long. So it is important to know that pre-recorded exercises are excellent, have to be adapted, and you have to respect your own limitations. Okay, and for example, if you want to build a an exercise program, use a reminder. You can put on your cell phone to remind you to commit a specific exercise protocol. I will talk a little bit about the challenges of such technique. I have already stated some of these. So the infrastructure in developing countries is sometimes insufficient to use these kind of technologies, and we have maybe some network limitation, so we have to take into consideration. Also, for some countries, there is a problem of electricity and electrical. So this is also something to be have in mind. And also sometimes some people, therapists, or either people with bleeding disorder refuse the complexity of using technology. Sometimes it can create a challenge or a barrier. So some patient or healthcare professional resist adopting this kind of service models that differs from the traditions they are used to. So we have to also take this into consideration. Other barriers are the linguistic and cultural differences. For example, now I am talking in English, but here in Lebanon, all people talk in Arabic. So whenever I want to give my session or instruction for somebody, I will tell them in Arabic. So the language barriers are sometimes also one of the challenges that we face during this online consultation or telemedicine. Also, the legal consideration should be taken into consideration. And sometimes there will be the system function, or because they are always evolving and developing, and these systems are complex, you know, so there is a potential of malfunctioning, which could trigger a software or a failure. Conclusion, I know that using such technologies or such consultation to organization or clinical services is a little difficult, more than the people may think, a little bit difficult, because it needs hardware, it needs softwares, it needs a lot, it demands from, it's something different that we are used to, the regular things that we are used to. So it demands major changes to organizational roles, means such as initiatives to be, and we should, because to have this initiative successful, we have to change mind to thinking that we want to use our service instead of implementing new technology to our services. Readiness to improve, to embrace such innovation, there must be detailed and careful evaluation of new working practices in order to ensure patient safety, because it's very important. We don't have our hand set before to see what's going on, to promote the clinical efficacy and the long-term sustainability. Thank you, and hope that you have had a little bit information if you want to implement such technique in your practices. So don't be shy if you contact your healthcare professional or hemophilia treatment center at your country and ask them for possibility to come or to build a rehabilitation programs through consultation. And now I'm going to give the floor to a very committed person, a person disorder, who didn't surrender for his disorder. He just was committed to a sports protocol, and now he is a sports instructor. His name is Andrew. So Andrew, now the floor is yours.
Thank you very much, Cesar. Thank you for the kind words, and I'd like to thank the WFH for again inviting me along to one of these MSK sessions. I love this community, and I'm more than happy to help out. And like how we've all been experiencing, this is my first WFH event on Zoom, so bear with me. I'm used to doing this in front of people, so we'll see how we go. I just want to preface the conversation, and my story is this is my point of view and how I've been living my life in the last 6 months while we've been dealing with COVID. I'm going to give you a little bit of a background of who I am, the current situation here in Australia, and then also what I've been doing to manage during that time during our lockdowns. My name is Andrew Selvaggi, as I introduced at the start of this presentation. I'm 33 years old and I'm from Melbourne, Australia. I'm a patient with severe hemophilia A, and I have chronic persistent inhibitors. I'm a qualified personal trainer, and I'm also a senior project manager at the University of Melbourne. I'm currently treated at the Alfred Hospital here in Melbourne. I won't go too much into my past and my history, but a little bit of context. At age 20, I was in a wheelchair, lost 30 kilos, was able to get up and walk around again. A little bit about my comorbidities. I have had 2 total knee replacements. I've had both my ankles fused. I've had 6 major orthopedic operations, the usual chronic arthritis in my old target joints, and my treatment program for the last 4 years. I've been on Hemlibra on the Haven 1 trial. So what I'm going to do now is introduce who I am. I'm going to go into just a little bit about the COVID impact in Australia and just give some context around the situation here. So I'm just going to share my screen. Sorry, I feel really bad. This is the first time I've spoken and the patient's the only person who's doing a slide deck. So give me 2 seconds. I'll just share my screen here. And I'll put that into presentation mode. I hope everyone can see that. So just a little bit, I don't want to go too much into it, but the COVID impact in Australia, everyone will know the Johns Hopkins University dashboard. That's the dashboard that everyone looks at day to day. We did have nationwide lockdowns in March to May. Our case numbers are relatively low compared to a lot of the other countries that my fellow panelists are from as well, but our population is quite small. So we had nationwide lockdowns from March till May. We had state-based easing of those restrictions in June, and unfortunately we've had a quite aggressive second wave leading to further state-based lockdowns for a minimum of 6 weeks. And one of those states is the state that I live in here in Victoria, in Melbourne. So that's from July 9 to August 20, and that has a bit of context into what I'm going to touch on in a little bit. We've had a large increase in community transmissions, and the lockdowns have been harsher the second time around compared to the first time. Our daily case numbers per million are about 28 per million. You know, comparing that to say countries like the USA, it's about, you know, USA I think it's about 213. Countries like Canada is at 10 per million. India's at 36 per million. The unique situation that we're in Australia, because we're quite a large country, the state that I'm from is the mainstay of where all the cases are coming from. So we've only got a population of about 6 million in the state that I live in. So when you do the numbers, we're actually in my state, we're at about 113 cases per million. So we're quite up there. We're half of the US per day. So they're taking it very seriously here and leading to quite harsh lockdowns. That's enough about the depressing stuff. So I want to go through this conversation and tell you that this is, for me, this is a tale of two lockdowns because we've been through one and now we're going through a second one. And for me personally, they were completely different. In lockdown, in our first lockdown from March till May, it was a sudden, quick onset of a lockdown. As soon as we started to get a couple of cases here, they suddenly shut the borders, put everyone into what we call stage 3, which is stay at home, can only go out to the shops, essential workers, as like Greg mentioned earlier. And it kind of really resonates for me what Greg was talking about earlier around how there's a, how do I put it? There's been some nice gains early on from inactivity, but then in the long term, there's been a lot of disadvantages to that, and I'll take you through that. For us, what our lockdowns meant is all of our gyms and parks were closed. So the only way that you were able to go outside is if you wanted to go for a run. They weren't allowing a lot of people to cross counties or cross councils. So bike riding was kind of out of the question because you would just have to ride up and down your street. You couldn't go anywhere. So going for a run for me is impossible because of my challenges with fused ankles and my knee replacements. So that left me at home. And for the last 10 years and working as a fitness instructor, I've never had a home gym, and I'm speaking from my home gym now. But this is a result of the second lockdown. The first lockdown, I had nothing, and I relied completely on external gyms. And like how we're saying most of our other seeing across the world, everywhere sold out of all fitness equipment as soon as they shut things down. My baseline is usually about 10,000 steps per day, and that dropped down to 2,000 steps per day. And my activity levels dropped to non-existent. And you'll see I've got a slide there showing my Apple Watch or my Apple activity tracker. And you can see that I look at the 3 rings of activity, standing, and exercise, and I'm not hitting my mark there every day. And that's a snapshot of April. As I mentioned earlier, the first 4 weeks were great. Swelling went down, movement felt a bit better. Those little niggles here and there weren't happening anymore. And then once we got to week 5 to 12, my mobility and my function in my joints suddenly rapidly decreased. Pain came back, and getting out of bed was a task, to put it lightly. My diet, sleep and mood and self-awareness varied day to day. So self-awareness being, say, proprioception, or what Greg was talking about earlier. And also had a lot of the mental strains of relationships, anxiety levels, working from home, all of that. So lockdown 1 wasn't a good story. And I just wanted to take everyone through that. And then coming to lockdown 2.0, as I'm calling it, in late June, gyms reopened and they said everyone can go back to the gym. And for me, that was amazing. And then 10 days later, everything closed again because we went back into lockdown because the case spikes. And what that meant for me is I had 10 days of amazing going back to the gym. I started to feel better. I had more energy. I was able to move more freely, and my motivation levels were up there. And going into the second lockdown, I wanted to challenge myself of how do I keep motivated? How do I keep moving? There's obviously stuff that you can do, and Pamela took us through it earlier, that you can do at home that without having to need all of the equipment. And I wanted to challenge myself. How do I do that? And how do I keep myself motivated? I'm a very situational based person where I like to go somewhere to be motivated. You know, for me, work is work, gym is the gym, home is home. But now in this COVID world, home is everything all in one. So what I did, the second lockdown, I set myself a 6-week lockdown challenge, and to come out fitter than I actually was 10 years ago. Because of the lack of movement and being stuck in the house, and we couldn't go anywhere, and not being able to run, it meant I had to dig into my pockets, and I kitted out a home gym, and I focus on spin and functional exercises. I won't go through what they are, but what has become really powerful for me, and what Cesar spoke about earlier as well, is tracking and being able to log my daily activity. And I'll share some of that data and how I keep myself motivated and how I go through that. So this is some of the data that I'm a project manager as well. So I've mashed together the perfect world of fitness and spreadsheets. And this is how I track my daily activities. So I I do 2 workouts a day, and I track things like duration, average heart rate and calories, and the type of exercise that I'm doing. And I also take a daily photo to see how my body's tracking. And you can see I do have a number of graphs that I track, how my average heart rate's going, and peak performance and things like that. But in terms of using something like this at home for anyone, you could do this for how many steps did I take today? How many times was I standing? Those types of things to monitor and track your activity without knowing how much you moved. It is very, very hard to say I was doing the exercises. So something simple like Pamela was showing, for me, I would say I've done that and I did these exercises, and then day to day I can track that. So that for me, logging these things is a very powerful tool. Like how we have treatment diaries. I also have an exercise diary as well. I will start wrapping this up. The results and the advice, for me, it's keeping active at all levels. So whether that is getting up out of bed a little bit earlier, going for a walk around the house, going for a walk up and down the street. If you can't, if mobility is an issue for you, it's doing what you can within your body's means. So Pamela was mentioning about earlier, I have TheraBands everywhere. They're for me when I can't move, or if I've had a bleed in the past, I would use something like this for an area of my body that I could use, and kind of keep active. So it's based on your fitness and your mobility levels. What I did find, and this is common and it's echoing across everyone's talks, is that keeping active, I had an increase in joint function, a decrease in arthritic pain. for me, any movement was better than no movement. So, you know, I found myself pacing around. I would take the long way around to go to the toilet, you know, while working from home at the desk. My lavatory is right next door to my home office. I would take the long way around, go to the front door, come back, and then go to the toilet. Better sleep and a routine. You sleep better and you have a better routine. Because you are more active, you're kind of more conscious about your diet and your weight management, and you are keeping actively healthy. And more often than not, the more active you are, the more prone you are to looking at the foods that you're consuming as well. My stress levels went down, and one of the good things for me personally was I noticed that my focus and my output while working from home was a lot higher. So I was able to focus for longer and be more productive as a worker, essentially. And to be honest, and my wife will probably echo this, my mood and our relationship's definitely been a lot better since my life is more balanced. So that's the end of my talk, and it is the tale of two lockdowns. I wanted to give the yin and the yang of it, and show the benefits and also the disbenefits of not doing anything. So thank you again for the opportunity, and I'll hand back over to Glenn now.
All right, Andrew, thank you very much. And thank you to all the panelists for a very diverse series of presentations that really encompass how we can best manage during this time when it makes it much more difficult for us to get out and get the kinds of exercises that are part of the activities of daily life, what we do every day. We've had a lot of questions. Some of our panelists have answered a few of these questions, and those are the simple ones. Those are in a middle column here under Q&A called Answered. And so I'd encourage you to take a look at those. What I'm going to do now is go through the questions and then either identify somebody to take it or look for a volunteer. And then we'll keep the answers relatively short so that we can get through most of the questions. We've had some great ones, and I think that the answers will help reinforce some of the points that our panelists have made. So the first one is I'm facing both shoulder bleeds quite continuously. Well, here are some, yeah, let's just stay here for now. I'm facing shoulder bleeds quite continuously. I'm taking factors. I start to do isometrics, but it bleeds again. And so maybe I can ask one of our panelists how to correctly measure the amount of exercise done versus the risk of bleeding. And that's a theme that's come up in other questions as well. If we don't have factor coverage, as a number of people who've listed questions here don't, how can we do the exercises without the risk of bleeding?
I'll maybe start, Glenn, and I would say that what's going to underpin the answer to a lot of these questions is I think everybody needs to be really clear that bleed recognition is a critical skill that everybody with hemophilia needs to have. And it is never going to be wrong to contact your hemophilia treatment team, to go over with them, to review with them, what are the signs and symptoms of actual bleeding? Because of this question, if you're talking about doing exercises and then your shoulders continue to bleed, shoulder bleeds statistically are not terribly common if we're talking about the shoulder joint. And so you'd first of all want to make sure that that's actually what is happening here. And I think that that's really the first step that has to happen. Beyond that, any exercise that you are doing for a joint or a muscle should not provoke increased levels of pain immediately while you're doing it or immediately after. I mean, extended periods of exercise where you maybe have some delayed onset of muscle soreness because you've just worked hard, if you're able to do so, is a different matter. But I would say to you, if you are exercising and you are provoking significant spikes in your pain, stop what you're doing at the moment and make sure that you contact your treatment team and go over what it is you're doing and whether it's the right thing for the status of your joints as they currently are.
Okay, thank you. Anything to add, Cesar?
Well, I think because I see this issue not talking about the shoulder bleed, but about the possibility of bleeding immediately after, or for people who have limited access to clotting factor. I think a lot of people don't give the amount of rest needed after a bleed. Okay, we have taken our clotting factors and the bleeding has stopped, so we can go back to our activities, or maybe even not, but they go usually to activities. So the most important is to give a little bit time for the bleeding or for the tears that happened inside the joint to heal completely before restarting the exercise program or protocol. And if you want to start a program exercise, even if it was static or not active movement, it to be respecting the limitation. So it has to be slowly and very progressively respect our limitation and the needs.
Okay, thank you both. There was a question about using pain medications, and I'm not sure that we touched on that. So I'd like to ask you your thoughts on pain medications during physical therapy. Yes, no?
For me, as part of a direct relationship to the physiotherapy program, I would say no. I think that there is a risk involved if you are using pain medication to allow you to perform your exercise routine, if that is explicitly why you're doing it. I think it's dangerous because what you may be doing is masking what is a built-in biological warning sign that something could be wrong. And so if the pain medication is somewhat separate from the physiotherapy program and they are running in parallel, that's different. But if one is in series leading to being able to do the other, then I would say no.
Yeah, I would certainly agree with that too. The one possible exception is after a joint replacement when you are covered a lot of prophylaxis and you deliberately are pushing that joint to regain motion. Then under those circumstances, it might be useful. Okay. The mobility, or the lack, I guess the lack of mobility because we're all in our homes. Greg, you commented quite a bit on that. How effective do you think that is in really allowing a target joint to rest? Is that a reasonable is that a reasonable thing to think that would have happened over these last 4 months, and that we may be in somewhat better shape now with our target joints?
I'll say something briefly, and then I'm going to ask Andrew for his comments. I think it is for a brief period, and I think that the amount of rest that was kind of enforced upon people, or could have been, as long as you were able to rest your joint effectively at home, it certainly allowed people an opportunity that removed some of the common reasons why people say they can't rest, because they have to get out to work, they have to be moving around, dropping kids off at school and things like that, or going to school if it's a young person. And so, yeah, I really do think that there was an opportunity during the pandemic to allow chronic injuries, target joints included, to rest. The critical sort of back part of that, though, is eventually lockdown ends. And if you have rest, doesn't mean doing absolutely nothing for extended periods of time. Briefly, yes, but then you have to come out of that in a gradual way. So Andrew, I'd love to hear your comments on that.
Yeah, Greg, I mean, it's kind of echoing what the elk of the conversations have been about. For me, I'm usually fairly adherent to say when I have a bleeding episode and then you need to rest. What this lockdown has done is shown what happens when you have really long extended periods of rest. And for me, the getting back up and getting moving again has been a lot harder than what it would have been if I'd had a few short days or few short weeks of rest and then commenced usual activities. So I think there's going to be a big challenge that we face as a community to become active again, and then the potential for bleeding. But for me personally, the more my body moves, the better I am. So that's my view.
Okay, thank you. I want to paraphrase a series of questions and ask you all a different kind of one. And then after that, I'm going to ask you about young children, very young children. So be prepared for that one. The question I've got is YouTube. And, you know, I've used some of the videos on YouTube. There's a lot of videos on working out and getting good instruction. They, of course, are all for individuals that don't have hemophilia. And so what kind of thoughts do you have about utilizing some of those videos and tailoring them to individuals who have hemophilia? What's your opinion on that? I'd like to ask all three of you that question. Greg?
Yes, sorry.
Go ahead. Well, my opinion on it is I think it can be great, and I think that's where I would place the onus on what I would like to do is work in collaboration with my patients. And you do the research, you find some videos that you think you're interested in and that you think might be appropriate for you. Send me those links, and then we either have a video chat or a phone conversation, and we sort it out from there. But there's tons on YouTube, and I think this is one of the ways we can leverage the patient community. For you guys, you go through them all, you find those videos, you send me the links, I look at them, and then we work it out together.
Okay. Cesar?
Yes, and what Greg have said, it's absolutely true, because all the time we want to give instruction on how to do the exercises, and there's some videos that can help this idea, or that can clarify what we want from the patient. But what I am afraid of is most of the time some people try to get excited than usual and try to do more than their body abilities. This is something I emphasize on, because even if we see some people doing some easy exercises for the elbow, for example, easy exercises for the knee, we should take care, because some of these exercises does not suit everyone. So one that is doing the exercise should respect very much his body limitation and stop whenever there is any kind of pain or any sort of pain that appears.
Andrew, what are your thoughts as a personal trainer?
I use the term "don't try this at home." I've seen quite a lot happen in general population and also in the hemophilia population. YouTube and videos out there are a very, very good way to get inspiration, but they're given in no context. So the person who's usually showing you the exercises is usually someone that's very fit, and it's very generic. So to echo kind of what Cesar said, it has to be level to your body's ability. So I work in collaboration with my Hemophilia Treatment Center, and like how Greg mentioned, all of my workout routines and exercises, I usually try to have rubber stamped or endorsed by the physio. If you are in a situation where you don't have a physio, there's some really good resources out there that WFH has around exercising, and there's a plethora of knowledge out there. So I hazard YouTube and exercise without context very cautiously. Okay,
well, thank you for that. So my next question, we've got a couple that have come from parents of very young children, 2 years old, 4 years old. What do you suggest to maintain activity and mobility for kids at that age that can't necessarily follow any sort of a prescribed path?
Nobody seems too eager to pick that one up. Look, I suppose with young children, I mean, there's always going to be that variable that it's not easy to reason with someone who's 2 years old, obviously. So the kinds of advice that we're giving now about contact your treatment center and don't do this and don't do that and make these decisions, that's sort of taken out of the mix with a child that young. I think what we really need to do is try to let kids, to be honest, be kids. And I think that a lot of children of that age, it's about hitting developmental milestones. It's about activity and exercise through play. I think you need to try to carve out, because a lot of people, as Andrew said, are working from home. Home has become everything. It's their office, it's their gym, it's still their home. But there needs to be some time carved out to make sure that those kids are getting an opportunity to play and be active, because they've been restricted too. They're not going to school, they're not going to daycares, they're not going to parks. So you need to do whatever you can to carve out that time every day so that your kids can be active in your home, that you can supervise that activity, that you can contact your treatment center if you see anything that seems untoward so that it can be caught quickly. We know that early changes to joints lead to long-term damage. So making sure that you are assessing your children for any sign of an injury developing and sort of jumping on that really quickly so that it doesn't become something worse down the road.
Any other comments on that?
No.
Okay. Another question that raises a broader issue is from a person who says that they have numbness in their lower limbs. I think he's sitting for an entire day at his computer, and he feels numbness in both lower limbs, but no pain in his hip or back, and electrical shock sensations periodically in his legs. I'll make a comment or two, but let's hear from our panelists first.
Well, I hate to keep jumping in here, but I think you've hit the nail on the head there with your statement, Glenn. A lot of time spent sitting. What a lot of people don't realize is that sitting places more pressure through the spine and through the vertebral discs than standing does. And everyone has heard or seen the articles that sitting is the new smoking. And I think that if you do have to work from home, consider trying to do whether you actually have a standing desk or raising your computer, if you work on a computer, to a standing height. Changing positions regularly is really key to maintaining tissue health. And it very well could be that this is nerve-related, sort of pressure-related symptoms coming to the forefront because of sustained increased spinal pressures through the discs and the nerve roots.
Yeah, I think that's exactly right, Greg. And so what I would add to that is in my situation, I am sitting here for 10, 12 hours a day. And halfway through the epidemic, I bought a new chair. That's very important, a chair that can provide you with sufficient support. And then I make a point of getting up in between my Zoom calls and have a little exercise equipment on the other side of the computer screen and just do 3, 4, 5 minutes worth of moving exercise. So I do think that's important, and there are all kinds of software programs that have clocks that tell you should get up once an hour and stretch and that sort of thing. So give a lot of thought to that if you are sitting somewhere, and think about the position that you're in. Greg mentioned stand-up desks as well. Many of my business associates have stand-up desks. Another question came in on, a few questions came in on stem cell therapy. And so let me just make one comment on that. It's not ready for prime time. This is an area that I work in professionally. I work on starting biotech companies focused on regeneration of various tissues, and stem cell therapy is just not there. And so it's highly experimental. A lot of good research is going on, but it's not something that will prevent us from having to have a joint replacement or grow new muscles. Muscles come the hard way. They come from work, as our panelists have all just described. There have been various questions about specific target joints, and I know that Pamela discussed a little bit of recovery, but maybe we could touch on recovery. So you've got a target joint, it's had yet another bleed in it, it's a lot of blood in the joint. How should a person with hemophilia approach that in trying to regain mobility, regain some strength without causing increased bleeding, assuming they don't have access to prophylactic therapy?
I will answer this because I live in a place where clotting factor is widely available. Usually the process of healing should be respected, because as I said earlier, I see a lot of people that they found that the pain has immediately gone, so they go to their normal activity and they have a bleeding again. So it's very important. The first thing to do is to give the bleeding joint a lot of time to heal. Maybe sometimes it depends, and they a lot how much time does it need to heal. It depends really on the amount of blood in this joint. So maybe 2 days for small, maybe more than 2 days for bigger bleeding. But at first time is very important. And then we use, of course, the resting joint, icing the joint to reduce the inflammation, compression, elevation. And then we, whenever feel that this bleeding stopped and the healing process has already started, we start with a little bit rehabilitation at first, slowly, to see where the joint stops us from. For example, to flex my elbow, I start slowly and see where I can stop, where the pain stops me, and then I continue my movement. Day after day, we feel that this joint is going better, so we can increase the range of motion. The same is for muscle strength. We work on not only range of motion regain, we work on muscle strength again. But we should always, during this is a long process, during this process, we should be very careful to prevent any kind of free bleeding or any possible bleeds.
Okay, thank you, Cesar. Quick question for Andrew from Bradley Rayner from South Africa. He wants to know if you use protein supplements and whether or not you recommend it for muscle building.
Yes is the answer. I do use a protein supplement. It's a whey peptide isolate, very clean, about 100 calories per shake, but they are not a meal replacement. And I would consult your healthcare professional before taking them. A lot of the supplements out there do have other things in them that can be an anticoagulant as well. So make sure you have all the nutritional information checked before commencing anything like that. But yes, I do use something.
Okay. Questions about fish oil and garlic. Fish oil and whether or not they inhibit coagulation. I'm not sure you can eat enough garlic to inhibit coagulation. So I don't know that you'd need to worry about that. And as for fish oil, it really should be taken by people who are at risk for thrombosis, who have elevated lipids, triglycerides. And so in that case, I don't think there's a concern about inhibiting coagulation. I think we're going to need to end. We have covered many of the questions, and we will try to finish maybe the few remaining questions, get them answered, and they'll be posted to the website. Let me confirm that with Louisa. Can you give us a time frame on when this will be up on the web, Louisa?
So hopefully we'll be up within the coming days. We'll have the slides as well as the recording available. And then we did notice, of course, that on the webinars, there's people coming from all around the world. So we are translating as well the session in transcripts. So it will be made available as well in Arabic and simplified Chinese, Spanish, French, and Russian for everyone as well. So you'll be able to read it in your own language. Thank you.
All right. Well, I want to thank Louisa, Zoe, and Antonio from the WFH for helping us get this organized. And then special appreciation to Greg, the head of our musculoskeletal committee, Cesar, who's incoming, and Pamela, who has been longstanding with the WFH in the international community. And then a special thank you to Andrew, who has given us some inspiration for what we can do during COVID in a reasonable way without causing more harm. And so that's really the key. Staying healthy, staying active, but understanding your limitations and what you can do up to the point of not incurring a bleeding episode. Greig, do you want to make any final statements?
Only to say that, you know, I was so impressed by the number of people who registered for this webinar, and I think that a lot of the virtual engagements that the WFH has offered up since the pandemic hit have been extremely well attended, and I think that that speaks to the commitment of not only the WFH, but of the patient community around the world. And I think these are the kinds of engagements that are here to stay. So I really just want to thank everybody who signed in and listened and participated, and I'm sure we'll be doing this again, so keep the questions coming.
All right, well, I've learned a lot as well, so thank you. And with that, we'll say goodbye to all of our attendees, and stay safe and be healthy.